Rural Americans make up at least 15 to 20% of the population, yet they experience significant health disparities due to limited access to health care. Filling in the gap, nurse practitioners. Joining us is Sophia Thomas, the president of the American Association of Nurse Practitioners, to discuss this. Because you talk about rural areas, we talk about areas that are underserved. Can you talk about the importance of people in your profession in these particular underserved areas?
Absolutely. This is so critical. The small town physicians that we used to have from days gone by just simply aren't there anymore. And physicians aren't choosing to go into these rural communities, and that's where nurse practitioners fall in. We actually have nurse practitioners who are registered nurses living in the community, going back to school, getting their advanced education and degrees, and then practicing in these small towns. It's made a huge difference as far as access to care. And this also goes further to the suburban areas as well, because there are health professional shortage areas.
And Sophia, you make such a great point, because physicians now, I don't know the exact numbers, how many go into family practice, but even the ones that do go into family practice are less likely to want to set up a general practice in a rural area.
And then, Sophia, you also raised the point. So I think when many people hear the word nurse, they don't necessarily realize the differentiation between a registered nurse and a nurse practitioner. Can you just share the training and the education that goes into what you are as a nurse practitioner?
Yeah, absolutely. So nurse practitioners have their foundation as a registered nurse. They're already practicing. They go back to school for advanced education, graduate degrees as masterate or doctorate prepared. And they assess, diagnose, treat, and prescribe for patients of all ages across the healthcare spectrum, managing acute and chronic diseases and disorders.
And how many years of education is that?
So it varies. Nurse practitioners have an educational base or a foundation, I would say, as an RN, and then they have an additional 2 to 5 years beyond that.
Sitting next to you is Charlene. Sophia is a nurse practitioner for your kids.
Yes, she is.
And she's played a huge role.
Yes. Well, it's about 11 years ago when I found out that I was pregnant with my first daughter, Germany. And I live in a small town, not many resources, but I found myself in a nearby city where I found Sophia Thomas, and she helped navigate me through that journey of having Germany as a first-time mom. And through the years under her care, she's not even my doctor, but she's become my doctor, my nurse practitioner, I should say. And my daughter's nurse practitioner, and she's become a part of our family.
Something that is incredibly important in today's day and age in healthcare, and that is this extra level of care. Yeah. A lot of people now expect to go see their healthcare provider and, hey, give me a prescription, or give me this, when sometimes really what you need is just a listening ear and some pragmatic advice. Would you agree with that, Sophia?
I would, and I think that's what sets our practice apart from others, is that we're grounded in nursing. We went into nursing because we care about people. We want to help people. And so with that foundation, we do pride ourselves on taking extra time, looking at a patient not only as themselves, but as the family unit. And health is really not just an absence of disease. It's really physical, mental, and social well-being. So when we are with our patients, we look at them very holistically, and we look at the whole picture. And so in the case of Charlene and the girls, it's not only taking care of the girls, it's taking care of Charlene as well, and making sure that she's the best mom that she can be. And she's been a phenomenal mom.
Well, thank you for sharing.
Willing to listen. You know, we're touching on the role of nurse practitioners in a rural setting, but I mean, nurse practitioners are everywhere. I know my son talks about it in training in neurosurgery at Northwestern in Chicago, big city, big place. But NPs play a huge role in neurosurgery, running the neurosurgical service. So you're finding NPs that specialize as well and have a very important role.
And I love what you said about that foundation in nursing, because I think the healthcare team really needs that aspect of empathy and caring for the whole family, the whole person, that caring, listening ear. So I think it's commendable where they're filling in all the gaps in healthcare, because we know we need the help.
Yes, we do.
We're very proud of that.
Sophia, Charlene, thank you so much.